Hey there, I'm Dr. Angie, and in this video, I'm going to be answering pet parents' questions about all kinds of subjects. It's like the miscellaneous video. So let's get started. Laura writes, "Hi Dr. Angie, I want to let my kitty out this summer, but he's also a senior kitty with kidney disease and I don't want to vaccinate him anymore. I got your newsletter and didn't understand what you meant by check a titer regarding rabies vaccination. I'd really appreciate if you could explain this to me. Do you think it's safe for me to let him out with a harness and not do the rabies test or vaccinate him at all if he's not exposed to wild animals? Can you also recommend a safe flea deterrent for him?" All right, so let's talk about the rabies vaccine first and the titer. So if you have an older kitty and you don't want to vaccinate them, but you want to see if they're protected against rabies, what you can do is get blood or have your veterinarian get blood and send it to HemoPet to have them check to see if your cat has immunity. Now, if something were to happen, this wouldn't hold up the titer, if you will, won't hold up in your local jurisdiction from a government perspective or any government regulatory body. So they're not going to recognize this. This would just be for your own benefit of knowing, okay, my cat does have a titer against rabies. If he were exposed, chances are he would not become infected with the disease. So it's kind of an alternative to vaccinating. Rabies gets a little tricky because it's not always recognized. In some, for cats, we think of panleukopenia as being a problem, and you can actually check a titer for that and not do the vaccine. So rabies is a little bit different in that it's more regulated from a government perspective, usually by your local jurisdiction. And then, do I think it's safe for you to let your cat outside on a harness? I do, and I think we all need to take measure of our risk and really assess the risk of a situation. So if you're outside with your cat on a leash and a harness and you're right there, the chances of them coming in contact with wildlife, let alone rabid wildlife, is quite low. And so in that case, I would not be worried. Now, if you're opening the door and letting your cat walk away, depending on where you live, like I live in a neighborhood, I don't have bats, I've never seen a skunk. For me, that feels very low risk. But you might back up to a creek where there are bats flying around, and bats are a carrier of rabies. So kind of know your area, ask your veterinarian what animals are the highest risk for rabies, and then assess. When I let my cat out, I don't watch him. He stays in the backyard, but it's possible that some other animal could come into my backyard and they could meet. So I did vaccinate him, but he's young and does not have kidney disease. So I hope that helps. And as far as natural flea and tick prevention, it's funny, I just wrote a blog about this. Here in Boulder, we don't see a lot of fleas and ticks. And so I feel a little bit like an imposter telling you how to prevent it naturally and knowing that it works. There are a lot of people in other parts of the country that I've spoken to, like veterinarians that are more holistically minded, and some of them still use, the chemical drugs like Frontline and NexGard, but I think a lot of times just flea combing, depending on where you live. Essential oils are a little tricky for cats, so I'm really hesitant. But if I weren't in a flea infested place, I might consider just doing a flea comb when your cat comes in to just check. So I hope that answers your question, but let me know if you have any follow-ups. And then Angela writes, "Do you know anything to help aldosterone adrenal tumors in a cat?" I don't. I have actually never seen one of those, but I'm pretty sure they can be taken out surgically. If I'm right about that, you can take those out, but I don't know. I've never diagnosed one in my career, and I have never treated one holistically. So I wish I had better information for you. Bob and Terry write, "My peekaboo," oh my gosh, that's the cutest name, okay, "has stinky drainage from her left ear. I took her to the vet and the doctor gave me ear mite cleanser. It helped for a little while, but now the drainage is back. I found it could be a possible yeast infection. If it's a yeast infection, would Monistat help? I know her ear is tender because she scrunches up when I try to clean it. Can you suggest anything? Well, I wonder if your pet was diagnosed with ear mites and if those ever cleared up. So that's important. So let's figure that out. And then if there is a yeast infection or whatever infection, most of the time with ears, it's yeast. It's important that we get it completely cleared up. I've never used Monistat in an ear. We use other antifungals in the ear. So I'm not sure if Monistat in there would be the best. I use a drug called Animax a lot. It's really inexpensive, but it has an antifungal, an antibiotic, and a steroid in it, and that usually works like magic. So what we need to do is get this ear infection cleared up. Whatever, if it's from the mites, from yeast, whatever it's from. So let's get it cleared up and clean. And you want to keep visiting your vet, and a lot of people get frustrated with this, which I completely understand, but let's keep visiting your vet until they can stick the otoscope in there and say, yes, this ear is clean. And if that ear infection comes back, then let's figure out why ear infections are happening. Because if if your pet has ear mites, it's not necessarily, an underlying problem. It's just the ear mite infestation. So I don't want to overreact and change your pet's diet and do all this stuff. But what I do want to make sure we understand is why your pet has an ear infection and if it's going to come back. Let's get it all cleared up. So let me know how it goes, and let me know if you have follow-up questions. Darlene writes, I have a 1-year-old cat who was diagnosed with heartworm, this is very rare. I just actually, a cat at my barn was diagnosed with heartworm, and I can't figure out if it came from here or not, but do you carry any products that would weaken the heartworms? I don't. In fact, I don't even see heartworm disease in dogs here. Like, once again, going back to this really privileged space I live in with parasites, I don't even have to think about too much natural flea and tick treatment because we really don't have them. And when we do have them, it's so short because it freezes in October here. So I don't. Heartworm disease in cats is rare. We can prevent it. I know that Dr. Will Falkner I think he's in Austin right now. I maybe would check in with him and see if he has a supplement or maybe more experience. Heartworm disease in cats is rare, and so you would want to find a veterinarian in a place where heartworm is endemic, that they see a lot, and that they could actually give you something from experience. Terry writes, I just found out my dog's vitamin D and ALT values, which is a liver enzyme, are both high. Could there be a connection with the liver value coming in high and the high level of vitamin D? How long does it take for vitamin D to leave the body? Terry, this is an excellent question. I don't know if they're related. They could be completely unrelated. What we need right now is more information. I'd be interested to know what other blood tests have been done. Has there been an abdominal ultrasound? How high is that ALT? Is it repeatable? A lot of times liver enzymes will pop up high, and then we check them again in 2 or 3 weeks, and then they're not high. So at this point, we really need more information. So I hope that helps. Let me know how it goes. If you have questions for me, I would love to hear from you. You can find me at Angie at BoulderHolisticVet.com, and I will talk to you soon.